Hello everyone, and thanks for coming along this morning. My name is Katie Guthrie and I am Head of Data at Scotland Is. I'm delighted to be here today for what looks like a really interesting session on the uses of 5G in healthcare. This is the second collaboration event that we've had with the Scotland 5G Centre, so it's great to be working with them again. So just a quick introduction to Scotland Is before we start. We've been around for a long time as a trade association for the digital technology sector, and we provide a collective voice on some of the key issues that the sector faces. We do a lot of work on skills, we provide connections, and we inform government policy through different research projects and including our annual survey. And my particular role is cluster manager for the data companies in Scotland. Data companies and jobs are strategically important to the Scottish economy, so ultimately my role is about helping to drive economic growth. But in terms of what that means in a more practical sense, my role is really about joining up different parts of the supply chain across the data sector. So we do a lot of introductions with companies looking for partnerships. And it's also about highlighting opportunities, sometimes for funding, sometimes for strategic direction. And from my perspective, that's kind of what today's session is about. It's also about helping address some of the common challenges data companies face, such as access to market and skills again. We work with academia, with government, with startups, with big multinationals, with the third sector, the lot really. And I kind of think of our role as being a bit like a can of WD-40 for the data tech sector. So apologies, that's a bit of a strange image, but it does what it says in the tin. And although Scotland Is might have been around for a long time, our transformation into a cluster management organisation is still relatively new. And I'm more than happy to chat to anyone about what we're doing. So if you fancy a virtual coffee, my contact details are on the screen. But today we're going to be looking at some of the case studies for the use of 5G in the healthcare sector. Improving remote provision of healthcare is obviously hugely topical, and COVID-19 might have escalated that. But there are other drivers, the environmental perspective, the patient care perspective, and a cost perspective. So I don't want to delay for too much longer, but before we get going, I just want to cover a few points of order. So first, Paul Coffey will give a quick intro to the Scotland 5G Centre. Then we have the three presentations detailing the different use cases. And then there'll be a panel session at the end. So please ask questions as we go along using the Q&A functionality in the webinar. But then we'll address the questions during the panel session at the end. And we can also unmute you during the panel session if you want to just let us know. In terms of running time, we need to finish a few minutes before 11, but the presentation should be finished about an hour or so, so there should be still plenty of time for discussion at the end. So I will stop talking now and hand over to Paul Coffey from Scotland 5G Centre. Thank you.
Thank you, Katie. Slides. Okay, oops, ahead of myself. Right. Good morning, everyone. Sorry, right, good morning. There we go. Right. So, yeah, thanks for all joining. So I'm Paul Coffey, head of Scotland 5G Centre. So I've just got a few minutes really just to introduce myself and the Scotland 5G Centre. So it's been an interesting journey for me. I've still not made it to Scotland. I've been in post, I think it's 10 weeks now, but yeah, with the COVID challenge, etc., I've not quite made it to Scotland yet. But end of this month, I will be heading north. So exciting times. But yeah, really excited to introduce this session today. I think certainly the backdrop of the this pandemic situation has really, as awful it is, it's kind of demonstrated and put us all into a position where we've had to embrace technology, we've had to do things differently, and step out of our our norm, our comfort zone. And certainly, healthcare has obviously been one of those services that's been stretched. And we've certainly seen positive moves as we've had to, as people have looked at how can we look at healthcare using technology and those services. So really, myself heading up the centre, really am keen that we take advantage of this and use it to our advantage to move forward and look at how we can use not just 5G but 4G connectivity to bring on healthcare and healthcare services is what is already a stretched service. But moving on. So to talk about the centre in a bit more detail around why it's there, what its purpose is. I've been involved in mobile telecom space for, dare I say, 25 years or so now, and 5G does seem very different. Whilst it's still only just at the early stages, it's very different to its predecessors. And 5G, it's not just a mobile service provided by mobile operators. It's going to take an ecosystem to bring it together. It's a jigsaw, and for us all to benefit from 5G, it's going to need that jigsaw of stakeholders to work together. And that's what the Scotland 5G centre's there to do. For Scotland as a nation, to be honest, it's to bring people together, to be that front door for Scotland, so we can, as a nation, get the best out of this. It's not just a mobile operator play. We all need to work together to accelerate infrastructure deployment, to get businesses ready for it, to enable businesses to get the most out of it, and even just raise awareness to understand what 5G is and how businesses can benefit. So when the network gets rolled out and get deployed, they're there to take advantage of it. So the centre's there as a focal point for Scotland to bring companies together, to raise awareness, and work with industry to accelerate that deployment. So it's a national centre. So to my knowledge, it's the only national centre focused on 5G and 5G services. And it's looking, its focus is Scotland, but our outlook is global. We're looking at the whole UK, but global as well, bringing investment into Scotland, looking at how Scotland can be a platform for those services. Whilst a lot of 5G use cases are looking at, densification of services in urban centres, but, the backdrop of Scotland is obviously a huge rural challenge. And if we can crack that and get that right, there's huge potential in that. We can reposition those services globally. There's the rural challenge is not just sitting there in Scotland, and we're already doing a number of projects around that, looking at shared spectrum and neutral host services, etc. But certainly, what I'm keen to do is we look at both urban and rural, and how we can kind of bring all those activities together, so we can make it easier to do business with, easier to deploy. It's not just about where we put the mast. It's the whole age-old problem of the business case. It's power, it's backhaul, it's sites, etc. And as we look to 5G and densification of services, that's only going to become more acute as that challenge in that demand increases. And we're here to try and to deliver or part deliver on this benefit. There was a good Deloitte report last year looking at what is the potential benefit to Scotland in delivering 5G services. So an increase in 17 billion to GDP by 2035. There was a recent Vodafone report a week or two ago, a couple of weeks ago, which didn't go out as far as 2035. I think it was 2025 and then 2030. But again, mirrored these same benefits to Scotland. So if we get this right, there's absolutely huge benefit to Scotland, and that's what the centre's there to do. Because if we just rely on the mobile operators to look at the existing business model, it will not happen. We need to think out the box. We need to do things differently. We need to look at how we push out those connectivity services there's good progress being made on fibre to the premise, but it needs to go more. We need to look at, what is the role of wireless in that? We need to be a bit more technology agnostic and look at the outcomes we want to achieve. And 5G has a role to play in delivering that and delivering these benefits. So the centre, we touched on quite a bit of this, but it's looking at infrastructure. How can we accelerate that infrastructure to Scotland? How we bring things together, the power, the depth, the access, to make it easier to do business. So it makes sense for the MNOs to roll out, whilst also looking at new technology, new business models. One of our projects that are active already that we're funding is looking at rural and looking at how we can use, shared spectrum in a neutral host way to really provide community access, a community 5G network. If we can get that and get that right, then we can repeat that. And then it's looking at, how do we bring people together? How do we foster innovation, collaboration? One of the things we're looking to launch later this year is a series of network of innovation hubs across Scotland, where we will bring people together. We will raise awareness of what 5G is and 5G capabilities. We will also support enterprises to build on that. So we'll have 5G private wireless networks and each of these centres that people can gain access to. And then they can build services on top of that ahead of when the commercial network is available. So, bringing that knowledge up, supporting those enterprises and those, SMEs, those entrepreneurs, giving them a support network to innovate, and then, supporting them in the delivery of those services. So that will give confidence back to the mobile operators to say, okay, there is demand there, and enhance and accelerate that infrastructure rollout. And we're also, we're active in a number of 5G Create bids at the moment. So there's a role there, again, that the 5G Centre has in bringing consortia together. A lot of SMEs and enterprises don't know, they haven't got the capability or the strength in depth, really, to access all of this funding. So we can bring people together and offer support services so we can benefit, Scotland as a whole. Okay. So, it's about a Scottish focus, but having a global presence as well. And we're there to offer kind of knowledge exchange and look at best practice. What is the best practice to gain for access to funding, to do deployment? Even a lot of the activity we're looking at the moment isn't just siloed on 5G. A lot of the things specific to 4G health at the moment, can be solved with 4G. So a stepping stone is accelerating 4G connectivity with a view to moving to 5G in the short term. So it's about bringing all this together and promoting those 5G use cases, because a lot of people just don't know how to go about doing some of this. So we're there as a focal point to bring people and help people and direct people. Okay. So a little bit on projects here. So the centre's funded by Scottish Government, and we've got our founding partners are the Scottish Futures Trust, University of Glasgow and University of Strathclyde. So it was initially established October last year, and then I said, come on, 10 weeks ago, and now we're moving on to the next phase now as we set up our strategic board. And these are the 3 projects we're currently active. But there's a number of other projects that sit behind this that we're supporting as well. So the rural connectivity led by University of Strathclyde. So that's building on 5G Rural First, which was a DCMS project last year. And this is, as I say, it's looking at the next phase of that, really focused on business models and how we can look at new technology and new ways of deploying spectrum to really solve that business case in those difficult to deploy areas. The second of our third projects is led by University of Glasgow, looking at the innovation districts. So that's really looking at how we deploy 5G urban centres, looking at small cells, network slicing, mobile edge compute, things like that. So really looking, the other end of the spectrum, if you like, looking at how we can deliver services in that urban context. And the third one, which perhaps isn't as sexy as those first two projects, but probably, certainly in the short term is more important, is about the assets and asset management. And it's looking at, how we can work in hand with the mobile operators and their partners to accelerate the deployment. So looking at, say, all those, where the ducting is, where the fiber is, etc. And, it's about connectivity, or getting, not just fiber to the premise, but fiber where it matters. That's what's important to me. Even wireless still needs to connect to fiber at some point. So if we can work hand in hand a bit better and get fiber to where it matters, and then looking at, fixed wireless access solutions, or how do we deploy small cell solutions in urban centres when we're not there yet, but perhaps I envisage 2025 as be the sort of time frame where we're expecting to have small cells deployed in big numbers. We need to start working on that now to ensure we're ready for it, and our cities are easy to do business with, so we can look at deploying small cells in great numbers, so we can realize some of those use cases and that will be recognized with 5G. So linking it back to kind of today and the economic recovery really on the back of COVID, we really need to do more. So I've kind of outlined what Scotland and Scotland 5G centres supporting now, but we need to go much further. And we need to. It's been well commented and documented that research and innovation is going to be critical to the economic recovery here. So we need to ride the back of this and really invest in our infrastructure to get that right. Invest in resiliency, and that is it's 5G is front and center to support that. So we need to really transform Scotland's economy. 5G has to support that and will support that. If we're looking to recognise that 17 billion in GDP uplift, then 5G is absolutely critical to that strategy. So, when we talk about 5G in healthcare, remote surgery is often used, but it's not all about that. As we've seen, recently, 70% of consultations for COVID have been carried out remotely. So that just shows we can do it. And if it wasn't for COVID, those 70% wouldn't have happened. Absolutely, I'm confident in that. So, a lot of those haven't been they've not been using 5G, absolutely, but it's been using, video calls or even, telephone calls. But remote consultations can happen. So we can use that as a catalyst to build on. And, we know reliable connectivity is going to be key to that. So whether that's 4G and building into 5G, it will be the catalyst to promoting that remote capability for healthcare services. And, as I say, it's not about, doing something dramatic as remote surgery, just smart devices, enabling smart devices to enable not necessarily real-time decision-making, but near-time decision-making, we know will save many lives and save critical services for the NHS. So that's what I'm keen that we bring. It's kind of those real working cases of 5G services. And we're going to be looking to promote these across Scotland in the near term. Okay, so that concludes, my probably a bit longer than 5 minutes on the centre and what we're doing and how we're supporting some of these. But please reach out if you want to get in contact with the Scotland Centre about how we can support you going forward. So I'm going to hand over to Ashley Timmins from BT now and Paul Campbell from the NHS for the next slot. Thank you very much.
Thanks very much, Paul. Just checking that everyone can hear me okay? Yep, great, thank you. So my name's Ashley Timmins and I work as a technical delivery manager within the CTIO team in BT. I'm extremely grateful to be asked along here today to discuss some of our 5G projects and innovation projects around the healthcare sector. Our partnership with the NHS, NSS, NHS Greater Glasgow and Clyde, along with Glasgow City Council and the University of Glasgow, has allowed us to demonstrate real 5G innovation I'm delighted to have Paul Campbell join me today, as he's been instrumental in bringing this new project to life. Paul, do you want to give a quick introduction?
Yes, good morning, folks, colleagues. My name is Paul Campbell. My background's a consultant anaesthetist in the NHS in Scotland. Been in the NHS for over 20 years. I've spent the last 10 of those years involved in the IT side of the NHS from sort of local to national level, and was delighted to help out with what's a really exciting project in making use of 5G to improve many of the bits of healthcare. And I think, as Paul Coffey just mentioned there, we had the view to do that before COVID-19, and then post-COVID-19, I think this becomes increasingly important. Thank you.
Thanks, Paul. I'm just going to share my screen. So just checking that you can all see my screen okay?
Yep.
One second. BT completely understand the challenges that the NHS is facing at the moment. Now more than ever, as Paul had mentioned, post-COVID, it's critical that we do things differently, but we recognise the great momentum and progress that was already being made to help deliver the digital channels for patients and health professionals. Since the launch of our public 5G network in May 2019, BT were working with a number of NHS trusts to deliver remote healthcare through 5G technology. Some of the successful use cases that we've delivered you can see on screen for the pictures. In June 2019, we delivered a remote ultrasound over our live public 5G network. Again, in October 2019, in an operational ambulance, a clinician at the Queen Elizabeth Hospital in Birmingham was able to remote triage with paramedics using AR and VR technology. There was also high quality and video feeds between paramedics and clinicians. The clinician was able to guide the paramedic over which was a wound at this point in time through haptic technology. Live images of the ultrasounds were relayed back in real time to the clinician back at the hospital. Virtual reality provides clinicians fully immersive experience of being in the ambulance. Augmented reality glasses, which were also voice command control, enabled paramedics to send clinicians close-up videos of the patient. Real-time feeds from 360 cameras, patients' vital signs and medical records and ultrasounds were also relayed back to the clinician and also throughout the ambulance. I'm just going to move on to slide 2 and 3, where you'll be able to see the view from the clinician from the VR headset. As you can see, there was many feeds. There was about 6 or 7 feeds all over the public 5G network that were relayed back to the clinician at the hospital. In March 2020, originally developed for the NEC Nightingale, BT at pace developed a remote health station. This was made up of 3 capabilities: a remote stethoscope, a remote ECG machine, and remote ultrasound equipment. Fortunately, this wasn't required at the NEC Nightingale, but is now currently being used at an intermediate care centre for the elderly, several miles away from the hospital. This just evaluates everything that Paul had said, that 70% of remote consultations are now done post-COVID remotely, and it's saving so much time and effort for the NHS, but also putting that co-creation together and how we can change the way that we work through technology. We've had really some positive feedback from clinicians that they can see the benefit and the real value through these trials and use cases. Some of the feedback that we've had that they've mentioned was the ability to access colleagues and senior support when decisions been needed quite quickly, and this has all been done remotely. It's fantastic. The potential to reduce the number of unnecessary hospital admissions, the fact that the regular routine consultations can be done remotely will reduce pressure on the NHS staff and also waiting times, along with reducing travel and carbon footprint. But now we move on to the exciting part and the project that Paul's been speaking about, and how we're going to truly enhance 5G breast screening through enhanced imaging through 5G technology. In January this year, we started discussions with Dr. Paul around the possibilities that 5G could bring to the screening services within Scotland. Working in partnership with the NHS, NSS, NHS Greater Glasgow and Clyde, BT now have a 5G solution ready to demonstrate once screening services can resume in Scotland. This will enable mobile screening units to connect to our network via 5G. Some of the day-to-day activities from the mobile screening units can be completed over our converged 4G, 5G network. But again, as Paul had mentioned, we are working strategically with the NHS to lay the infrastructure foundations that will pave the way for advances in the screening technology. Our 5G solution will enable mobile units to send high-quality resolution images back to the main screening centres directly from the unit. That will mean that they'll not have to upload these images and send them later at a later date. Real-time communications back to hospitals and back to peer-to-peer clinicians for further feedback can also happen in real time. This can also tackle health and care inequality by offering a drop-in session when screening services are in the area. Improve productivity as more screenings can be performed each day as the radiographers are able to upload those images and send them back, saving time and effort. Early detection through enhanced resolution images will potentially save lives. And this is where it gets really exciting. Patient feedback process can be reduced from weeks to days to even hours. That's where we see the real value. Our 5G solution will allow and support the ability to send and upload 3D tomosynthesis mammograms in real time. For those of you that are not aware what 3D tomosynthesis are, they're bandwidth-hungry, high-resolution images. This is a new type of digital X-ray which creates 2D and 3D images. This tool provides the ability to detect early breast screening cancer and can decrease the number of women called back for retesting. The 5G solution will support the foundations for developing AI technology, which will then act as a first stage triage along with the potential for real-time communication between clinicians by using AR and VR. These advances in technology will provide more accuracy and efficiency and will enable faster detection, and this will potentially save lives. This is where we see the real value and requirement for 5G capability. As we've said before, not all of these tasks need to be done on 5G, but it's paving the way for the future. Through the partnership and co-creation with BT, are delighted to be part of this evolution and 5G-led digital transformation within the NHS and NHS Greater Glasgow and Clyde. Paul, I'll pass over to you to then pick up some feedback from a clinician point of view and how you see this paving the way for the future.
Yeah, absolutely. Thanks very much, Ashley. So just, thinking back to the earlier slides you had there of that was a sort of trauma case with sort of a laceration and then working out sort of in the field real time where to take that patient. That there are many sort of uses for that technology. We could consider that and even within our sort of remote and rural areas here in Scotland. But I suppose if I could just focus on this last slide here, the one about the breast screening service. Maybe just give a wee bit of context to that, colleagues. In Scotland, we have over 300 different sites for breast screening, and many of these screening services, you probably may well have seen them, are carried out by sort of mobile vans that go around. We've got some large urban centres, about 6 urban centres in Scotland, and over about 300 different remote sites. So as Ashley and I think Paul have said, much of this could be covered by, well, not much of this, sorry. Some elements of where we have a challenge, even just simple connectivity in these areas, could be covered by 4G technology. But that would, give us the ability to maybe sort of run real-time appointments and just connect to our systems. But the very nature of this particular business, sending fairly large images, really starts to require a larger bandwidth. And the more advanced we get, the more we get into 3D tomosynthesis, the more we get into potentially running real-time artificial intelligence decisions on triage, which is definitely on the horizon for the whole radiology community globally. Then we're definitely going to need more bandwidth. So I think this is it's a fantastic experience that for once we're set to put the infrastructure in, right and properly at the beginning. Often we have the ideas and we don't have the infrastructure, and we're running in the back foot trying to shore up the infrastructure. So this, for me personally, having been involved in the sort of the IT side of things, is a great opportunity to be setting the infrastructure. It's going to help us right now, but actually also provides a way for lots of future development. So hopefully that just gives you a wee sense of my views on that from the screening service in particular. This is one. There are many other areas that we can then go to after that. So I'll pause at that and hand over, I think, either back to Paul if he wants to say a few words, or if not, I believe our next presentation is on to John Wilson. So thanks, Ashley, for putting that together.
Okay, thanks, Paul. Ashley, yeah, if we move on to next presentation.
Good morning, everybody. I'm John Wilson, CEO at Agenta. If I can just make a couple of apologies in advance. Obviously, I'm working from home. This is a fake background behind me. So if any of my daughters come in trying to attack me or put makeup on me, or my dog barks in the background, I do apologize. Hopefully we can get through this without any hiccups. So let me just share my screen here. So assuming you can see this okay? All good?
Yeah, John.
Grand. So for those who don't know me or know Agenta, we're a Scottish company based out of Leith. We're a tech software company. We have been involved predominantly in healthcare, education, and the public sector since inception. On the healthcare side of the business, we, over a course of a few years, have helped build and design some of the leading doctor consultation applications and services that are out there. Some of them you might have heard of, things like Push Doctor, Doctor Care Anywhere, Babylon Health, Spire, Bupa, and quite a few of the other ones that are in the marketplace just now. Over the last sort of year or two, we've got more involved on the kind of secondary care side, working with people such as Napier University, the Digital Health and Care Institute, Swan Capita, and most recently Glasgow University, Nokia, NHS Highland, the Data Lab, on creation of a project for enabling smart healthcare across 5G. On the education side of what we do, we own and operate one of the largest global remote education delivery platforms called vScene. It used to be owned by Janet before we acquired a division of Janet, JISC. We host, operate, manage our entire video architecture in our data centers in Scotland, government approved data centers. All the video and audio traffic goes through our data centers in Scotland. We've got a strict adherence to security, data privacy, data security, and management of users. But for now, what I wanted to kind of focus on is a little bit about the healthcare landscape, particularly when it comes to remote delivery. So as you know, the telehealth legacy, as we like to call it, is how remote healthcare, telemedicine, telecare is managed at the moment. Now, the focus is on reactive treatment rather than preventative care. And non-effective use of patient data, using static data rather than real-time, and reliance on manual input to clinical records. Most importantly, it's difficult within rural communities to support this proactively, not just reactively. And currently, video conferencing services that are provided and used across particularly rural communities are difficult to use and expensive to administer. Sometimes requiring the patients to use a laptop, a tablet, or a smartphone, which, as you know, are quite difficult for the majority across the frailty spectrum, which I'll discuss shortly. And also sometimes requiring people to travel to the next available GP surgery or center that can host video conferencing. What our approach is to the smart home healthcare platform is more of a kind of patient-centric, autonomous platform that doesn't allow or require any intervention by care professionals. What we've designed is a 360-degree monitoring and management system utilizing real-time data gathered from non-invasive environmental sensors. I'll talk about this shortly. most importantly, the ability to reach across rural communities, ensuring digital inclusion. We don't require anybody to have a computer or a smartphone or a tablet or any kind of PC in the home. Instead, everything is managed, operated, and controlled directly from the television. 95% of patients have a television in their home, so it makes sense to utilize that existing technology that's there. The system is designed to integrate with many different kinds of e-health platforms and digital clinical records. We've designed it in such a way where it's fully agnostic, both internal and external, providing APIs that can integrate with any kind of digital health exchange. Data from these devices that we've created can be anonymized and can be used for multiple different purposes, such as medical research bodies and other healthcare providers for the advancement of medical research, but also the aggregation of data to pinpoint specific aspects of health recovery, rehabilitation, and ambulatory admissions to improve the whole patient-centric pathway. What we've designed is what's called Health Hub, which is a smart home health monitoring tool. It's an all-in-one device which sits on top of the television and uses the television for the data management, the video calls. It also integrates with sensors around the home and is 5G enabled as well. Yep. So what it does is it gathers data, multiple different data reference points from non-invasive sensors and medical devices. Now we've focused on the non-invasive because we've found limited success from wearables. Things like wristwatches, breast straps, chest straps, that kind of thing. Obviously, it's quite difficult to manage wearable devices. Things like batteries depleting, and also they're quite uncomfortable for people to wear them. So we integrate over Bluetooth and Zigbee in the home with different devices. These can be PIR sensors. These can be glucose meters, spirometry, EKG meters, things like that. So we can gather and aggregate multiple different data reference points in order to be able to create a pattern based on the pre-agreed care plan, which can create what's called flags. So if we see a degradation in data, or if we see a fluctuation on either spectrum of changes within data patterns, we can create flags. These flags can be customized in many different ways. They can be text messages, emails, they can be automated video calls, audio calls, that kind of thing. As a simple case example, one of the case examples that we've got is early fall detection. So as you know, a quite significant amount of ambulatory admissions can be drastically reduced if we are able to utilize data in such a way which tells us before a fall is about to happen. Now, this can be gathered in many different ways. If we see a significant decline in movement, if we see a decline in oxygen levels or a fluctuation in oxygen levels, a fluctuation in heart rate, and also in some instances a change in CO2, a change in humidity, temperature, that kind of thing, we can ascertain falls before they actually happen. So using real-time data from environmental sensors, if any of these thresholds are crossed, what we can do is using the television, we can automatically connect to a family member first, or a care professional, or a doctor if it's required. So the way that this works is no intervention is required. It does give the person at home the ability to accept or decline the call, and it will automatically ring on the care professional, care practitioner's device or the family member's device on their end as well. So the family member can then decide if any steps need to be taken, if any assistance is required. Most importantly though, this kind of helps the loneliness aspect of being at home, particularly just now with COVID. You know, many people are isolated. You know, they don't have the ability to speak to family members. They don't have the ability to say if there's anything wrong. So what we're doing is we're allowing them the ability to speak and connect with anyone that they need to in order to improve that situation. The device is fully encrypted. It connects over the network into SWAN, the Scottish Wide Area Network, which we host a large architecture on. This allows us to connect to any of the 22 health boards, GP surgeries, and some of the social care departments within local authorities as well. On the other side, it will also connect to any kind of mobile device as well if you've got the app installed. Yeah. On that end, the family member or care practitioner is able to look at the data to see where the flags have been raised, and also can compare this against baseline data as well. Okay. This is all done over extremely high resolution and frame rate. Now, this is important when it comes to the 5G side. You know, there's lots and lots of video conferencing services out there. 99% of them aren't particularly good when it comes to immersive human experiences. By utilizing the 5G network, we can enable the encoding and decoding of 4K video at 60 frames per second. This allows us to ensure a human experience, which is crucially important. You know, the last thing that anybody wants when they're sitting at home is someone to come up on the screen that they can hardly see. The audio's cutting out, the frame rate's cutting out, that kind of thing. We want it to be extremely high resolution on the television, as what they're used to watching a 4K video on the TV, basically. Yeah. And by utilizing the 5G network, we can maintain that. So that's it for me. There is a lot of other projects that we're working on just now. One of them is the 5G Create consortium that we put together just now with the University of Glasgow, Nokia, the Data Lab, Perth and Kinross, NHS Highland, to create a test bed across a couple of rural communities within Scotland. And we're expecting this to be done across maybe 100 to 150 homes to allow us to make sure that we evolve the solution and continue to configure the solution so it meets exactly the criteria and the deliverables that's required to. There is questions and answers at the end, but if there's any questions that spring to mind just now, I'm happy to answer them. Okay, well, my colleague Chris McKibben, who's also on this call as well, who's also managing the project for the 5G Create Consortium, will also be on the call at the end as well to answer any questions. Okay. I did well for time there, and there was no barking or kids, so that's good.
Thanks, John. That was really interesting. I guess a question. Well, I guess firstly, yeah, to the attendees, that the Q&A is open, so either chip in or you can post a comment, a question, and we can pick that up at the end. But just on John, on the 5G aspect of it, so I think you picked it up towards the end. Really, it's kind of, you know, you can. It sounds like you're connecting in the home through Zigbee or something similar, and then it's the kind of backhaul to that kind of TV or, you know, that connected TV to give you that 4K high quality video to, I guess, give the patient confidence and that immersive experience. Is that aspect right? Yeah.
Yeah, exactly right. You know, if we're trying to utilize Wi-Fi in the home or 3G or 4G, it's going to be quite difficult to get to the levels of experience that we want. You know, 5G allows us to really provide a more human experience. You know, at the end of the day, if we're trying to replace human visits, then you're going to have to do it in the best way possible. You know, you're going to have to make sure that it's as close to the human experience as can be, and 5G allows us to do that.
Yeah, and I guess, you know, in terms of who you're engaging with, you know, the elderly and the frail, etc. They want to be, yeah, pixelated experience. It's very much that immersive experience, human experience.
Absolutely. I'm a part-time carer for my mother who has COPD. She's on oxygen. She can't use her legs, and she finds it difficult to use her wrists sometimes because of the whole kind of ailments that come off the back of COPD. You know, and to ask her to use a tablet or a laptop or a smartphone You know, forget about it. It's practically impossible. And this isn't just her. You know, this is the majority of people across the frailty spectrum. You know, unless there's actually physically a care professional there holding a laptop and setting up a video call, then there's no benefits there. And that kind of defeats the purpose when we have to have somebody to travel out there to initiate any kind of video call. They should be able to do it as and when required, if and when required, you know. So fully autonomous, not requiring any pressing of buttons or intervention or anything like that, allows us to have a complete invisible yet effective solution.
Okay, good. Okay, thanks, John. So yeah, we're now going to hand over to Nokia, to Graham Harold and Simon Parry, who'll give their perspective.
Oh, sorry, Paul, just before we do that, Marushka, one of our attendees, had a quick question for John. Marushka, I think I have unmuted you, whether successfully or not, I'm not sure, but the question is, I'll let you try it. It's not really time for you.
Can you hear me?
Absolutely,
yes,
Okay, no, so I'm from Villicom, so we install mobile signal solutions to hospitals all over the past 2 decades now, all over UK and Ireland as well. So my question is, do mobile signal black spots in hospital pose a big problem for you, or a challenge for you, John?
Mobile black spots, obviously, yeah, they are going to cause a challenge, you know. But just to be clear on what we're trying to provide, although we do support hospital, we're trying to provide the connectivity for rural communities to connect to care professionals. And these care professionals, sometimes they might be located in hospitals, but most of the time they're going to be located in other parts of the community, you know. And it doesn't matter where you are, you know, 5G black spots are going to be an issue. You know, we've designed the solution that it does, there's a few mitigations in there. So if we can't get 5G, we can go to 4G. If we can't get 4G, we can go to 3G. If we can't get any of those, then we can use Wi-Fi signal. You know, we need to build a solution in such a way where we can integrate with other kind of network connectivity that's there as well. So where there won't be 5G, there will be, hopefully, other situations, but other network connectivity. But you know what? There are going to be situations where we can't support it, you know, and this just allows us to kind of enforce the message that we need to increase the width and the breadth of the 5G solution in order to be able to deliver it to anybody within communities.
Thank you, John.
Okay, yeah, thanks, Marushka. Okay, so let's hand over to Nokia, Graham and Simon.
Good morning, everyone. Yeah, thank you for the opportunity to speak with us. My name is Graham Harold. I'm here with my colleague Simon Parry. I am country manager for Nokia in Scotland. Simon's going to do most of the talking in the slides, but I just wanted to set the scene on Nokia because hopefully most of you know we don't make mobile phones anymore. We've moved on from that. Have a fairly extensive end-to-end portfolio, and one of the key areas in that is the development of 5G. So just picking up on a few of the points that were made, I've kind of changed a couple of things in my notes, but one of the mantras that Nokia had prior to the current experience of COVID was we were looking as much as possible to reduce the digital divide, not just in smart city type projects, but also in smart regions. We were seeing an increasing gap between the ability for people to have good services, good connectivity home for education, but also healthcare. So our mantra has been to try and bridge that gap. Now that, having the portfolio we have, can mean trying to get fibre everywhere. And one of the things we're looking to do in a lot of the smart city projects is get 100% fibre connectivity across the city or region. Obviously, there are areas where that can be covered, so more and more we're looking at 5G to fill those gaps. And as John mentioned from Magenta, one of the projects we're looking at has a very much a rural aspect to it. So what Simon's going to take you through is what we're looking to do in areas with 5G and building private wireless infrastructures that can enable better connectivity to these rural areas with the absence of fibre. So without further ado, I will pass you across to Simon.
Okay, so I'm Simon Parry, CTO for Nokia's enterprise group here in the UK and Ireland. Wanted to talk to you about some of the things that we've built. So first of all, the Children's Hospital in Helsinki is an example of where Nokia has built a private mobile network with the cooperation of Elisa, who's the local operator there in Finland. And what this is for is you have a hospital, you have lots of people using things. Wi-Fi is good, Wi-Fi has some uses, but hospitals tend to be made of really solid materials, lots of nice strong walls and lots of metal. And so you need hundreds and hundreds of Wi-Fi access points. You're also fighting with all of your patients, especially in a children's hospital. There's going to be a lot of devices, a lot of things wanting for the patients to attach to Wi-Fi. And then people bring hotspots, bring their mobile phones into the area. And perhaps you also want indoor mobile coverage for things. One of the things that Nokia can do is we can build you an indoor mobile network using different frequencies, using different SIM cards to the public network. What does that mean? It means your clinicians can walk around with tablets that only connect to the private mobile network. And so far, no one's hacked SIM cards. So they can have something that's guaranteed to be secure. You can replace pagers with smartphones. You can have enhanced video. You can have remote experts. You can have all of the advanced stuff through the hospital. Up until now, most of this has been developed around 4G technology, but come September, we'll be able to do this with 5G indoors as a standalone network using the latest standards, and therefore provide connectivity that is separate from the public network. As BT mentioned, there's some brilliant use cases for the public network where you want large, wide-scale coverage. But there are also times when you want your own guaranteed bandwidth separate from the public network, especially in places like hospitals where you've got a lot of people, a lot of things all densely packed into one area. That having some of your own connectivity has huge appeals. And we've been talking to this a number of hospitals, a number of things across the UK, but this is one that we've already built in Helsinki. Another example we have is thinking about 5G in a different way, but thinking about 5G for things. This is the University Hospital in Aulu in Finland, and this is where you want clinical supplies, or you want new medicines, or you want new PPE, and you need it delivered around the building. And they've been using robots for a year or so now, but it's accelerated post-COVID, where you don't want people wandering around, you want things that you can sterilize. And these robots, are delivering assets, are delivering PPE, medicines, those sorts of things to the wards around the hospitals, which means that your pharmacy can stay separate and you're isolating the people. It cuts down infection. And we work with Omron, we work with a number of robotics providers. But the reason, you need connectivity. And these robots go pretty slowly, but because it's a 4G network, they've got to navigate the people around them. But Nokia is using it in their factories, similar things for stocking the production lines. But we're also looking at how to cooperate. And with 5G technology, because you can get more data going quicker, you can actually make the robots go faster because they can use advanced cameras, they can use advanced processing to navigate humans, to navigate hospital beds, to navigate the complex human environment. And you can then, so from robots moving at a very slow walking pace, is we're already up at robots traveling essentially at running paces and getting quicker in the same environment as humans without crashing into anything. It's really quite impressive to watch. We can also overlay a location solution, so you can find the damn things. Apparently hospital beds, are the things that vanish somewhere inside hospitals. And lots of equipment, finding heart rate monitors, finding ventilators, where they've relocated themselves through the hospital. So it's these sorts of technologies built on top of a private mobile network that allow you to move forward with this stuff. What's Nokia built? Nokia, as well as being a leading supplier of radio equipment, we've also built a private mobile core that sits on a single server, which means that your data stays local, i.e. the hospital data never leaves the hospital. The GP's data never leaves the GP surgery, so that you can control it and manage it through the access controls because taking confidential patient data to the public network adds layers of security, adds layers of complexity. If you can keep all the data physically local, you can control it. And this is a cloud managed core. Intensely, you can manage multiple sites across the world. And we've deployed it across all sorts of industry verticals, ports, airports, manufacturing sites. Toyota have just adopted it for their factory in Japan. We have all sorts of use cases, this idea. And because the data stays local, it's inherently low latency. A lot of the applications, a lot of things people talk about is low latency. We can already do sub 10 milliseconds on a 4G network, and it gets really low on a 5G network. So a lot of these use cases, these applications that people want to build in 5G, we can do quite a lot of them already on 4G. And it's all designed to scale up and scale out. Another thing we can do is we have a whole range of using 5G to connect remote locations, fixed wireless access. Ofcom, the UK regulator, has decided to offer some very nice 5G spectrum at a very low fee. So to build your own fixed wireless access mast and cover 2-4 kilometers, it's about £800 a year per site. That's it. You know, the BT, who are now sort of, you know, coughing and spluttering, having spent hundreds of millions and billions on licenses, is, you know, in a very different situation. Those are high power national licenses. Ofcom is offering low power local licenses so that you can do short distances, doesn't go very far, but you can have high bandwidth fixed wireless access around rural locations. So to get that last hop out to houses, to doctors' surgeries in difficult locations, you now have an option to do private mobile spectrum in partnership with the public mobile networks of the likes of BT and the other operators. So, you know, we have an interesting range of devices that go inside houses. We've also got some nice cute things that like stick on the outside of windows and have a flat cable, so you can just take it through an existing window. Don't need to drill holes in the walls, but it gives you quick, simple, high gain access using 5G technology for fixed wireless access to cover a number of the use cases that have been talked about before, where there are not spots and where there's difficult coverage. Other trick you can do with it is a pop-up bubble of connectivity, that if you need to have you know, a specific location, I don't know, testing center, breast screening center, and you want to pop up a bubble of connectivity in a particular location as a temporary measure. You know, we are already doing truck mount solutions. This is quite a big one, but got some small ones that fit in the back of a transit that allow you to pop up the connectivity, have secure connectivity around that, and then use a variety of backhaul. If there's the public network and you've got great 5G coverage as BT's providing, then use that. If you know a location that's more tricky, we have a bunch of microwave and millimeter wave solutions that will get you out of valleys and some of the more challenging locations of geography in Scotland. So there's all of these options that are available that are coming, and it's all geared around the fact that Ofcom has found this 5G spectrum and it's making it available for enterprise and other applications at a remarkably low cost. So, you know, what do you do with it? You know, we've tried to build this around plug and play so that you plug it together, it boots itself up, you're up and running in 15 minutes. You have a whole variety of things. We tend to think of mobile networks around handsets and tablets, but actually it's as much around machinery and modems and connecting things together, whether it's robots or cranes or autonomous vehicles or remote experts. There's an increasing number of things that people want to connect, especially to a 5G network. We've designed this around security. A number of our customers are military and aerospace, and in fact, ports get hacked the whole time. Apparently, it's very useful to know shipping information. So, you know, we're used to building networks that need to maintain privacy and are under attack the whole time. Quite a lot you can do at 4G with a nice straightforward evolution to 5G, and a mix of indoor and outdoor networks to, as the lady from Vilcom was just talking about, you know, certainly, you know, hospitals especially are very challenging buildings from a radio perspective. People like to build them with thick walls, and X-ray machines and other things that cause problems for radio networks. We have a lot of experience in building those things, and that's you know what Nokia is a slightly different thing to talk about, and something we'd like to offer up. So in an effort to try and bring that in under time, that was a very brief overview of the sorts of things that you can do with private mobile networks and where we've built them around the world.
Thank you, Simon. Mary, I think just elaborating a couple of the points Simon made and
Okay.
the point Paul made earlier on. I mean, what we're trying to do, and I think the phrase ecosystem has been used quite a lot as well, is build that network of partners to look at that sort of end-to-end solution. So where we see we provide a lot of the foundation elements, but this gives enterprises, it gives smaller entrepreneurs the ability to build a network in an environment that they currently can't. But we also work closely with the large carriers in terms of we provide underlying infrastructure for their global networks, but more and more of these carriers are working with us in this sort of private wireless environment to deploy isolated solutions that their current network can't coverage as well. So the ecosystem piece and the partnering piece is very much at the forefront of the Nokia strategy and taking our 5G story out to market. So thank you for that. And if there's any questions, we're more than happy to take them on.
So I've got a specific question from Paul that I'm going to answer because it's kind of ours, and we'll leave some of the general ones for Q&A. How hard is it to do in 15 minutes? Genuinely, if I had more time, I'd show you the video. The radio heads are about this big. They're slightly bigger than Wi-Fi access points. You stick them up around the building. We have indoor and outdoor ones. You plug one of those in, plugs into the mains, connect it up with a piece of cable, plug the server in, turn it on. In terms of knowledge to set it up, if you can set up a Wi-Fi network, you can set up one of these. You plug SIMs into devices. We solve all the problems for you. It is really ridiculously simple to use this stuff with the scale of it. But in terms of planning it around the building, one of the neat tricks is we can go to slightly higher powers than you can with Wi-Fi. So it's about 6-to-1 ratio. So if you need 60 Wi-Fi access points, you need more like 6, 8 of the private mobile access points. So it cuts down cabling, makes it easier to install, makes it quicker to install. We've done these remotely during COVID. We've had people install them in factories. Lufthansa connected up their factory in Hamburg for servicing aircraft. They do remote experts, so that you have a guy from Derby who knows everything about engines looking over your shoulder using video conferencing technology to tell you to undo that bolt and not that bolt. So we've done that without even visiting sites. So this stuff is becoming really easy to use. And on that point, we should probably finish and drop to the wider Q&A, if that's okay.
Okay, thanks, thanks, Simon. Graham, yeah, it's really interesting, and I totally support it. I think this new spectrum that's been made available from Ofcom is, and Paul Rhodes was going to ask, he asked my question there as well. How quick and easy is it to deploy this stuff? And certainly for Scotland, I think we can just create these kind of community 5G networks, and I think it's a great use case for these to bring in connectivity into this space. So really keen to endorse that and look at how we can get some of that deployed. Because as we've touched on through this this webinar, it's a lot of this comes down to just connectivity, and then you can build on a lot of these healthcare services will come on, but a lot of the basic stuff can be solved with basic connectivity. Okay, so if we start, we've had a few Q&A on the panel here. So if we start working our way through there, and if you've got more, please chip in, and we'll work our way through them. So first one was from Callum Sinclair. Are there any countries which are world leaders in remote healthcare? What are they, and how do we catch them up and surpass them? Thanks, Callum. I'm going to give that one to John, perhaps, for first dibs on that one.
Well, I mean, it's obvious. It's Scandinavian countries. It's as Nokia will attest to, being for Finland. There's many different reasons, whether it be political or economical, or the fact that they don't have as much of a legacy kind of infrastructure as we do across the NHS and the wider sort of health spectrum that we do here. They've pioneered a lot on every aspect of healthcare, the digitization of it across rural communities. You know, I mean, they're still going, they're still working hard. And what can we do to kind of lean on them? You know, we've already engaged with a few players out there just now through our partnership with the Digital Health and Care Institute. We've spoken with them in the past. Whether that would warrant a partnership, a kind of consortium, I'm not sure at this stage. But I think the key thing is just to be aware of what they're doing and make sure that we. Yeah, I mean, the thing that sets many countries aside is their kind of approach to innovation. You know, there's many blockers when it comes to public procurement. There's many blockers when it comes to partnerships and things like that. In Scotland, you know, we are innovators. I'll make that clear. We are innovators, you know, but we do have difficulties. You know, every local authority wants to do things differently, and it's very difficult to kind of ensure that the lines of communication are ones that adopt and kind of improve innovation, you know. So I think when it comes to making sure that we're ahead of everybody else, is less about trying to compete with other people, but more trying to improve the lines of communication ourselves to ensure that we can adopt innovation properly, you know. And that's all it is. You know, we need to be able to respond, react, and improve very, very quickly. And I think that's the key thing. That's the key message from my perspective, you know. And I've worked in this industry for a very, very long time, and I've bashed my head against a brick wall on numerous occasions, you know. So it's all about improving the lines of communication and ensuring that innovation is quick and reactive and responsive, you know, to make sure that we're ahead, not just of other countries, but ahead of ourselves.
Okay, thanks. And I don't know too much about the healthcare system in Scandinavian countries, but you know, we've had a follow-up question from Alan Whiteside just asking about how we collaborate with NHS to adopt these technologies. You know, and I see, you know, that is probably one of the key challenges. It's not the technology itself. So how I guess firstly, how have they perhaps Simon, if you want to start with this one, how have they managed to adopt that in Finland initially? You know, is there an NHS? Is it public funded? And what do you think we need to do to get the NHS on side for this?
Wow. There's a politically loaded question. So yeah, it's a publicly funded healthcare system, not entirely unlike the NHS, but there's a very different scale. You know, that these are significantly smaller countries, and they're facing the challenges that they have a few, you know, reason. You know, the town of Aulu is 1 million people and is the 3rd largest city in Finland. You know, it's you know, they are much smaller countries, which means there's less pressure on the density of spectrum. So the operators are willing to do slightly more creative things. So it's as much as the creativity of the mobile operators, as well as the finding creative ways for a publicly funded healthcare system to work with the private sector. You know, in many ways, Scotland probably has it easier because it's not quite the same scale as trying to do things in England, which is, you know, just a ferociously complicated thing with too many people. So I can't provide you with any massive magic insights. I think drawing the analogy is probably very good. They too, certainly, you know, all of the Scandinavian countries have some really big problems with rural healthcare access because the distances get very large and the population gets very thin. So yeah, definitely a conversation to be had there. I was just going to also pick up that, John, the other country that has a massive remote healthcare system is Canada. Again, very large distances, but also the fact that they're not that far from the US. And so for example, you know, consulting an expert, so telemedicine and some of the remote surgery things have been done with the American money in places like Boston and Chicago, working in very rural locations in Canada. So there's been some interesting cross-border efforts going on in there as well.
Okay, thanks, Simon. And Paul, have you got anything to?
Yeah, I was going to say, could I just come in on that?
Yeah, there you go.
So in answer to it, I'm glad you went to Simon first, not me, because if that's not a politically loaded conversation to get into, I don't know what is. It's a very difficult, challenging space. I think I'd reflect also just on the history of the NHS, in Scotland and in the UK. It's a long-standing history, and we've woven a very interesting web that sometimes maybe needs to be untangled. One way I think to do that, it's not a magic bullet, is to really focus on what we need, not the technology. So, all this technology is fantastic, but it's really identifying what the use case is, what's the need, where do we have a big problem? I think you touched on it yourself earlier on, Paul. Robotic surgery, fantastic technology, really, really clever stuff. And on certain occasions that might become incredibly useful. But you'll not see many newspaper headlines about the challenges of waiting times for robotic surgery, if you know what I mean. It's the challenges we have in mental health, elderly care, social homes, waiting times, operations. So I think it's the one thing I would say is focus on what the challenges are, and really focus and make sure that the solutions that provided for that really help the system and help the users of that system, be that either the clinicians helping the patients or the patients themselves. So.
Okay, yeah. Are you aware of any, something like this happening in the UK at all? I mean, it'd be great to get something similar to what's going on in Finland in hospitals.
So the Aulu example for you?
Yeah.
Yeah, so I mean, I know I did for a while work in Greater Glasgow and Clyde. So NHS GG&C a number of years ago, in fact, pulled together lots of their pharmacy distribution centres. So I've been down I can't remember exactly, somewhere in the south side of Glasgow. There's a large pharmacy distribution centre, and right in the middle of that is a whole area run by robots. You can't even go in. Interestingly, they move so fast, it's too dangerous to go in. I don't know that they're using 5G networks, but so we do have some pretty enhanced things. I think the National Distribution Centre in NSS in Scotland is using quite a lot of advanced technology to help supplies throughout Scotland. So we do have a lot of innovation, but I also detect the challenges when companies come with good ideas and try to get into the NHS or the health and care space. I think agencies like ourselves at NSS and Digital Health and Care Institute, as John mentioned there, we keep trying to break into it, and I think resilience is key. Keep going, but ruthlessly focus on the need rather than the technology.
No, I mean that's a common thread. I think really it's looking at outcome orientated benefits, and whether it's this or any use case, we really need to be focusing on that. And that's
the one I suppose just reflecting on that final comment there, and it is a common theme, but I think now is a really good time to be quite opportunistic, to show, for example, hospitals like the hospital in Finland there, the Children's Hospital, which actually I've been very fortunate to be. It's an amazing place. You should see what they've done there. I think now is a good time to really capitalise. So yes, focus on the use case, be aware of the technology, but actually start to think about outside the box. And I think there is an onus on industry to challenge us back in the NHS, to think differently, show us other things that are being done around the world that are better, and also help us when we've got ideas about how things could be done differently. So on the back of COVID-19, there's a huge transformation in healthcare. So now is a really opportune time to come with new ideas.
Okay, thanks, Paul. So there you go, Simon. You heard it there. Let's industry up there.
Okay, on that. It's kind of a perfect storm. That the beginning of 2020, Ofcom released this frankly huge amount of spectrum for private use. At the time, and COVID has, just everything is happening at once, and it's not just healthcare, but a lot of industries are looking at what does 2021, 2022 look like, and the new shape. So we're a little bit busy right now. Which is a lovely problem to have, but it's a bit like it's certainly people there's a real hunger to accelerate change. I think that's what we're seeing is that the crisis has caused an acceleration of things that were kind of slowly coming, have had to come now. and that's probably because, and to Paul's point, it's the use cases. We've been remote consultations and video consultations have been kicking around for a while, but we've suddenly had to adopt them in spades, and that's reflected across all sorts of industries.
Okay, perfect. Okay, thanks. And on the you're looking at private networks, putting them in the hospitals. Do you think the future of those is to remain private, or will there be a neutral host element to them where they'll be opened up to public MNOs as well, and almost a slice offered to those guys for coverage? And
the challenge, as with all of these things, comes down to money, and who pays who for what and why, and what is their motivation. And it would be lovely to have perfect public mobile network coverage through a hospital, but that requires an investment of hardware and who pays who for what. If I'm going to point to another one, is coverage on the London Underground has been kicked around for 30 years, 40 years. Actually, last month we finally got it going, and actually, but that took 20 years of smacking various heads together to figure out who paid who for what. The technology is almost the easy bit once you've figured out the rest of it. So the future will be a mix of everything. It won't be one solution fits. It will be to Paul's point, is what's the use case, what is it there for, who's paying for it, and what are they getting out of it.
Yeah. Okay. And just while you're live, as it were, question on Wi-Fi 6. So another kind of unlicensed. How do you think that fits into the?
So it's all complementary. Wi-Fi, and especially Wi-Fi 6, has a lot of really cool assets, but you're in an unlicensed spectrum, and therefore everyone can use it. So especially in healthcare settings, a patient turns their own hotspot on, and it kind of blows a hole in your beautifully engineered coverage. So it's cheap. It's very can be very effective for certain applications. Not sure I'd try and run a clinical network in anger. You start to build these tensions up. So all the technologies are great solutions, and it's trying to find the right one for the right use case.
Yeah, agreed. Okay, what have we got next? So maybe a question for BT on use of satellite to provide remote connectivity, and maybe it's the satellite and the kind of hybrid connectivity of satellite 5G, which is probably where I kind of think it's got a role. But maybe BT want to chip in on that one. Ashley, perhaps.
Yeah, no problem at all. So there's all sorts of connectivity that we can use, and we've talked about this converged network, whether it's more of a digital fabric that we look at. So it could be 5G, it could be private network, could be pop-up network, satellite. It shouldn't actually matter to the end user what the technology is. It should just be they fire up their laptop or their iPad or whatever, their phone, and they can connect seamlessly, whether it be any sort of network. So we are now pushing towards that digital fabric and putting that infrastructure in, whether it be satellite, 5G, and we're looking to do that and roll out and work with partners such as Nokia, Ericsson, other vendors for sort of pop-up and 5G, private networks. But I guess we have our own sort of 5G spectrum, and as more and more 5G masts become lit, when we start to galvanise that across the UK, I guess as we say, that the end user shouldn't have to know shouldn't have to worry about what connectivity they actually have.
Yeah, agreed. Okay, thanks, Ashley. Okay, I think we've answered that one on NHS. Any other questions want to pop in? I mean, from my perspective, see if any come in. Obviously all mobile operators have got commercial 5G networks live at the moment, and that they will roll out. But it's these private networks. I think now is the time for that. It's the opportunity, and we got the Ofcom spectrum, and as Simon was saying, apparently 15 minutes you can pop up this this cloud RAN. So yeah, I think that is the opportunity, isn't it? Whether that's fixed wireless access in a community or health applications or anything, from my perspective, that is the real opportunity to demonstrate the value of 5G services that it can bring in that kind of short to medium term. And everyone says, what is 5G? How can it do? That is the use case for me. It's these kind of private deployments, whilst perhaps then, as the commercial networks then, in time will migrate to SA architecture, and then we'll perhaps start to see some more, exciting, innovative things to a more of a consumer play. It's certainly an exciting place to be at the moment, and from a Scotland perspective, I'm keen that we're the centre is supporting and embracing some of these, and working with NHS Scotland to get on the forefront, and we can get some of these trials up and running to demonstrate this. I think. As Paul was alluding to, on the back of COVID, there is an appetite to do things now, and we've already seen, 70% were saying of consultations remotely. Let's take this, use this time, take that to the next level. What can that actually mean next? How can clinicians and patients benefit that on the next level? So
Can I just maybe add to that point? I think I see a question from Alan there and mentioned there, how do we work with NHS Scotland? So one way is we need to really reconsider that a wee bit. There's a lot of change going on. Primary care is changing. We're linking much more directly with patients, having reviews done of their medications by pharmacists, going directly to pharmacists for sort of first line sort of healthcare. We've got dentists connecting into the network. Referrals happening from optometrists now. We're trying really hard to get better link up, and already through COVID have done that with sort of linkage directly into care homes, etc. So one way that might be helpful to address this is not think of us as a compartmentalised thing, the NHS, but to focus on the entire pathway from the citizen's perspective, and that may be an avenue to help industry partners recognise all the different collaborative elements that are required, the agencies that are required to collaborate to support the whole pathway from a patient's point of view. Again, this is being looked at, very actively right now, but how we do things differently. And we used to have quite rigid barriers, but what we could and couldn't do, and now's a time to challenge that, I would say. So yeah, focus on the whole continuum of the pathway might be another way to go about it.
Yeah, no, agreed. Yeah, that's cool. Okay, if there's no more questions, I'll hand back to Katie to wrap up, I think.
Thanks, Paul. And I guess I'd just like to say thanks very much to all the participants and all the attendees for coming along, because it was certainly very interesting. I've got a few more questions myself that I might pick up offline, because I'm aware we need to wrap this up, but it's been very interesting. So thank you very much, everyone.
Okay, no, thanks all from myself as well. Yeah, really engaging webinar, so thoroughly enjoyed it. And yeah, hopefully looking to Scotland to bring on some of this, and yeah, to Paul's point there, maybe we can look at this from a end-to-end pathway perspective. Okay, right. Thank you all.
Bye-bye.
Thank you.
Bye.